I always feel that I have the best job in the world because I can do procedures that are making a dramatic and direct impact on my patients' lives. My name is Dr. Sarang Mangalmurthy. I am an interventional cardiologist and endovascular specialist. I specifically focus on the circulation in the body. And when patients have blockages in the blood flow to their heart or to their legs, there are procedures that I can do that involve balloons and stents to open up that circulation. Stenting is an alternative to traditional surgical procedures to bypass the vessels, and we have a lot of success at keeping these stents open for the rest of people's lives. There are other circulation problems that patients can have, particularly in their legs, for example, with their venous system, where they get problems of leg swelling and skin changes. A wound on their foot that's not healing, and that patient's going to lose that leg without increased blood flow. And those are also procedures that can be done minimally invasively. I can deal with the expected situations and the unexpected situations because I have a lot of experience having done these procedures day in and day out for many years. Everything that we do is through a tiny little hole, and through that, we're able to do a lot of very complex procedures to fix blockages. And I think when patients hear that, they tend to feel reassured that they're physically not going to be experiencing something that's going to take a lot of recovery afterward. Technology is constantly evolving. New techniques, new equipment, new procedures, wires, balloons, and physicians like myself are part of the initial rollout for a lot of these new technological advancements because of the volume of patients that we see, the number of procedures that I've done in the past. It's important for patients to understand that Main Line Health has a robust research program, because not only does it give them the opportunity to get access to technology or procedures or medical treatments that may not be available at other institutions, but it also reminds patients that they're at an institution that is cutting edge. Nothing in medicine can quite compare to the feeling that you get when your patient improves. I follow these patients for years on end, and so seeing them in the office year in and year out just reminds me of the reasons that I became a physician.